Hello and welcome to yet another episode of Health and Social Care Topics. I hope you've been keeping up with the videos. And today I will be discussing a topic that is very useful to people working in and people studying health and social care. The topic in discussion today is multiple disciplinary teams. And these are what are usually used in supporting the individual journey. Okay, by supporting the individual journey, the main purpose or the main focus is person-centered care, which means that the care is personalized or individualized to meet that person's needs. It's not a one-size-fits-all, but each and every person has got different needs, and by meeting those needs, a lot of variations have to be met. Okay, by variations, what it means is there is a difference between equity and equality. Equality is giving everyone a share of the same amount of anything that you're providing, as that means that everyone has been treated equally. However, when it comes to health and social care, there is equity. Equity means that there will be variations where other people will be provided with more, other people will be provided with less than others, so that they are all on a level playing field and everyone then has equal opportunities. Okay, so that's the starting point. A multidisciplinary team involves a lot of different professionals, different qualifications, different levels of working, and so on, and different responsibilities as well. A typical multidisciplinary team that involves supporting the individual journey, I would use an example of a care home supporting, let's say, young people with autism. Within this context, what then happens is you've got carers, you've got a chef that works within there, you've got nutritionists, you've got the person's physician or doctor or GP, you've got the person's psychiatrist if there is any mental health issues involved, there could be a psychologist, and so many other individuals, sometimes social services, the police may be involved, as well as schools or anywhere where they do receive any sort of provision, be it education or health related, okay? By being in a multidisciplinary team, it means that these professionals at some point have to either communicate or they have to have meetings, because all of them are collaborating in some way, even if they don't work with each other closely or with each other at all, but at the same time they are collaborating in meeting this person's needs, and sometimes they will need each other's information as it is valuable to meet the goals that they seek within their profession. So for example, if you're working in youth work, and a multidisciplinary team might include a safeguarding officer, a youth worker, social services, someone that works in social services. It might also include the police and safeguarding officers from school. So when it's a safeguarding issue, let's say a young person discloses a sexual relationship with someone that's overage and they are underage of consent, rather than as a youth worker deal with it yourself, all you're supposed to do is pass on the information to the safeguarding officer. The safeguarding officer then has the capacity to decide what action needs to be taken, whether it's just advice and monitoring, or straight away call the police and report it as a crime if there's, depending on what's been disclosed. That also will need to include social services, as well as if they were a looked after child, the care home that they are looked after at. Okay, so that's how a multidisciplinary team works. It doesn't have to be under the same roof or under the same building or working effectively together hand in hand. However, that might include sharing of information. It might include having meetings together, so that each and every part that's involved in that person's life, they need to know where to start, they need to know where to end, and they also need to know other factors that might be influencing behavior, other factors that might be influencing any other outcomes, including physical and mental health. Okay, so that's how multiple disciplinary teams work. I hope that helps, because that's just in summary, but we could actually discuss it in many contexts, and like I said, it could be anywhere within health and social care how multiple disciplinary teams work. So I hope you found this useful, and please comment, share, like, and subscribe, and I will keep you updated with more videos coming. So as for now, thank you so much for listening, and goodbye.